certainly looks like next week we expect to see a pretty significant decline in cases to follow the pattern that we've seen elsewhere. The state as a whole has peaked and has started coming down. The country as a whole has. That's mainly, though, our much more urban and populated and suburban areas, our two coasts, and of course, areas in the middle of the country are still seeing a rise in cases. If you look at places, across the world, obviously South Africa's cases declined significantly. England's cases, they've peaked and they've declined significantly. And other places are starting to experience their surges. It goes through pretty quickly. So I'll just go ahead and take questions and we'll go from there.
Thank you for that. At this time, we have our first question coming in from Jean. There is some chatter now that some studies show people who have been vaccinated are now more prone to get COVID than those who are not vaxxed.
Well, that's just a sheer number thing. So if you're talking COVID naive people, so people who have not had COVID or been vaccinated, just by sheer numbers, if you look at the denominators, if you have a very, very highly vaccinated population, obviously the numbers of cases, you're going to see higher numbers in people who are vaccinated. Again, we know for sure that the vaccine protects, not necessarily against infection as much as we would like to see, especially with Omicron, but it definitely protects against severe illness, hospitalization, and death. The overwhelming numbers of people hospitalized are those who have not been vaccinated and those who are hospitalized for COVID-related reasons, not those who turn out to be positive and hospitalized for something else. So I think that's the big thing. And in public health, that's a success. Now, if you're looking if you're talking about the recent CDC study that was published in the MMWR, that was people who had COVID and people who'd been vaccinated. Remember, when you have COVID, you develop antibodies to more than just the spike protein. You develop antibodies to the nucleocapsid protein, the membrane protein, the envelope protein, whereas the vaccine is focused on the spike protein. So there can be some more cases in people who've never had COVID and are vaccinated than people who have had COVID and are vaccinated or even are not vaccinated. I think the data shows pretty overwhelmingly that those who have both, have been vaccinated and have COVID, probably have the best immunity.
Okay, again, if anyone has any questions, please ask them using the chat or the Q&A. All right, Nick has a question here. Could you talk about some things that people should remember as the most recent surge is hopefully on its way out? To what degree, if any, can people relax? And also one other piece here, to what degree, if any, can people relax, of course? And then I've seen some reporting that we may get a bit of a break post-Omicron. Do you believe that is true?
So I do. Omicron is surging and it's running across the globe. We're still seeing a significant number of hospitalizations. Our hospitals are still stressed, and again, but it's not proportionate to the number of cases, right? So hospitalizations are up and our hospitals are stressed and they're getting everything else too. But it's not proportionate to the number of cases of Omicron we have documented, let alone the number of cases of Omicron that are not documented, which we know could maybe be 4 or 5 times as many of those that are documented. And the other good thing is that those who are being hospitalized with it overall do seem to be less ill, so they do have a decreased length of stay, and not as many ending up in the ICU and on ventilators. But again, if you look at that denominator, just the sheer numbers can still lead to a lot of people being in the hospital. So it is still with us. But looking at other places, looking at South Africa, looking at England, looking at Sweden, they've all had their Omicron surges and are in various phases of peaking and starting to come down. But again, the deaths did not go up proportionally. The hospitalizations did not go up proportionally. So I think that's a very positive thing. There are some estimates that Omicron, by the time it's finished, is going to infect 3/4 or more of the entire global population. And remember, we like to use vaccines because we know that in general, that we can predict any adverse effects are going to be within the first 6 to 8 weeks after that vaccine. It's not going to be anything long-term popping up. Whereas with infection, if the body doesn't clear infection, we don't always know if there's going to be something popping up later on. So when we have a safe vaccine, we always advocate vaccination over infection. But we do have to acknowledge that people who've been infected do have some immunity. We don't know long-term for any of the vaccines or natural immunity, but we do know that people who've been infected have immunity to multiple proteins, not just the spike protein. We do know that they're working on vaccines for that. So we are not, our immune systems are not naive right now like they were when this first presented in the spring of 2020. Between vaccination, infection, and both, we're in a much better place. We don't know of another variant right now that is going to outpace Omicron. Omicron is burning through. In general, the curves go up and they come down pretty symmetrically. And so we do expect on the other side of that we will get down to just what we call that endemic level, where the disease is around, it's circulating, but it's not causing the disruption that it has caused. And certainly our hospitals, although wintertime is always a very stressful time for our hospitals because of all the other circulating things and everything else on top of it, but our hospitals will not be as stressed as they are adding on the stress of COVID patients, and even patients who are admitted for things that are not COVID but test positive for COVID. Remember, the hospitals still have to take all of those protections and the personal protective equipment, and everything has to be done differently. So it's an added strain on our healthcare workers and our hospital systems. As far as what we can do, I mean, I do think there is light at the end of the tunnel, and that this is the beginning of transitioning to that. We know our younger population, the vaccines have been approved for 5 and up. We're hopeful to have vaccines very soon for those 2 and up. As I said, we're hopeful to have some vaccines that are looking at more than just the spike protein. So we've gotten it to where it's very manageable. Everyone has to do their own risk assessment, and that has to inform their behavior. Omicron is circulating everywhere, and when I say that, Israel is one of probably the highest vaccinated country, the highest boosted country, and the most strict mitigation measures in place, and Omicron is surging there. So it is everywhere, and it is going to run its course, and we are very thankful that overall its severity is less, and that people are not getting as sick with it. And we are thankful that overall we do have some community immunity there. And so I think it will kind of push us to that next stage. And then, there are certain public health precautions that are good no matter what respiratory or other infection is circulating. And we talk about it. Hand washing is always a good thing. Not touching your face, because if you have something on your hands and you touch your face, that's how you can spread the infection. Good respiratory etiquette, coughing into your sleeve or covering your cough and then washing your hands. Staying home when sick. Those things go a long way in preventing transmission. Certainly, I think those who are vaccinated and those who have been eligible and gotten their boosters can be very comforted that they are well protected against severe disease, hospitalization, and death. And they might get Omicron and they might feel crummy. They may have just a cold or no symptoms, or they may have flu-like symptoms, but they're very protected against more severe outcomes. And so those folks might be a little bit more liberal in what they do as far as going out and gathering and doing social things. Those who are higher risk, those who have not gotten vaccinated, they have to look at their behavior and what puts them. We know that this is spread indoors in close situations, poorly ventilated situations. Ventilation is really important, and that's why outside activities are always going to be better during whenever we're having any kind of respiratory spread. Unfortunately, the weather often drives people indoors when it's cold here, and in Florida when it's warm. So people really do have to start doing those risk assessments to inform their behavior. Excuse me.
Okay, we've got another question coming in from Jean, actually a series of questions related to testing. So we're going to break this down a little bit here. What is the significance of getting all these free test kits out to people?
I mean, it's just to make sure that people have the ability to test. And certainly if you're having symptoms and you're not sure what it is, because the symptoms overlap from other respiratory illnesses, you want to do that test and you want to know if you're positive. We are at a point now, I mean, we certainly cannot case investigate and contact trace every case. There's just too many cases. And so we do ask people, if you get sick, if you test positive, let people you've been around know, so that they know to be on the lookout. And they may modify their behavior as well, as far as the quarantining and staying away from people who are high risk, and masking and whatnot. So I think it's just getting those tests out there so people have access to them. People tend to prefer the rapid tests. We still do have PCR testing during the week through the health departments, and we can get those results back in a fairly quick way. I also think a lot of people, even, the CDC did reduce the quarantine, the isolation guidance down to 5 days. And it says if a test is available and you can do the test, then that's good. If not, somebody who's tested positive, as long as your symptoms have improved or you're asymptomatic and you're not having any fevers for 24 hours, you can go ahead and go back out and continue to mask. So having those tests gives you a little bit added security there. If you test negative, then you can be much more comfortable going out. If you test positive, obviously, you should still stay. If you're testing positive on an antigen test, then you really do need to still isolate yourself, self-isolate, so that you're not spreading infection. So I think it's just getting more availability of testing out there for people to have a little bit more access.
Okay, I'm going to do a two-part question here. So in general, I think you've already addressed this, but we're going to make sure we get it clearly out there. First part, when should people take a home test, and how does more testing help slow the infection rate?
So more testing, I don't think it's going to slow the infection rate. Omicron is spreading, so I'm not sure that anything's really going to slow it right now. I think having those tests can help individuals kind of take control and kind of inform their behaviors. So if you're having symptoms and you have a test, even if you don't have a test, stay home. But if you have a test and it's positive for COVID, you can go ahead and inform people that, hey, I developed symptoms. And it shouldn't be a shameful thing. I mean, we get these people who feel guilty that they've done everything right. They've tried their best to avoid it, and they're getting COVID. Omicron is that infectious, that it is just spreading. And we have to accept that's going to happen, and there's nothing to be ashamed of. But like any illness, if you are sick and you're at risk of spreading it to somebody else, you do want to do the right things and stay home and notify people that you were in contact with, like, hey, I tested positive. You may want to monitor for symptoms or test. Those folks who are asymptomatic would recommend around day 5. If someone tells them that they've been exposed, and they're not having any symptoms, recommend you can test around day 5. In general, what we're finding is, people develop cold-like symptoms. They develop some symptoms, not, and they just really don't attribute it. They're like, oh, I had a scratchy throat or a sore throat, or I had a little bit of a runny nose, and they just don't even think about it, because that to them is like a normal cold symptom, and they don't think about that. So even the slightest symptoms that you don't even really attribute to being symptomatic could be COVID. And at that point, trying to stay, self-isolate and not add any. But I mean, the reality is it is kind of spreading pretty exponentially throughout the world. And as I said, I think the best evidence of that is someplace like Israel, which is highly vaccinated, highly boosted, and some of the strictest and upheld mitigation strategies.
So what would you say the motivation for people to order these free tests would be and to take them? What's a good motivation for that?
I think, as I said, someone who has symptoms, if they have the test and they take the test, they know that they have COVID. Some people, before they go visit loved ones or before they travel, they want to test and just make sure for a lot of reasons. Number one, they don't want to be getting symptomatic when they're visiting folks or when they're traveling. Number two, you have to have, you're going to have to, with travel right now, people have to present tests. And I know the home tests that are not monitored aren't verification, but if you have to have a test before you travel and you do that home test, then you can go ahead and make arrangements that you have to, change around travel plans. People coming back in the country from international travel have to have a negative test right now. And there are lots of people who have traveled overseas and then they get stuck there because their test when they're overseas to come back to the country turns out to be negative. We've heard of lots of situations where their stays are being extended. So, I think it can just be a little bit of reassurance. It can be a little bit of guidance, and it can kind of help you navigate if I do have COVID, if I don't have COVID, especially. They're pretty reliable with symptoms. They're not 100%, but nothing's 100%. So, if you test and you're negative, then you can feel pretty confident that it's not COVID. And if you're practicing, your basic infection prevention and control, then, that's the best you can do. It's never going to be 100%. And as I said, it is spreading even despite mitigation. But we do the best we can to try and do our part to not contribute to the spread. I grew up in a time of chickenpox parties. I said that before, where when someone on the street had chickenpox, everyone took their kids over there to deliberately get chickenpox. Now we have a vaccine for chickenpox, and we also know that people who've had chickenpox are at risk of shingles years down the road, which can be very debilitating. So, getting that chickenpox vaccine, is definitely the way to go. Same thing with COVID. You don't want to intentionally try to get infected. You don't want to intentionally or, just carelessly be out there deliberately spreading it. It still can be very, very serious for certain individuals. And we want to do our part, recognizing that we can't just look at COVID. We have to think about everything else, and we can't stop living and working and doing things. So, use those tests in a way to help inform our behavior to continue to do our part.
Okay, this appears to be the last question we have in the queue. So if anyone has any questions, again, use the chat or the Q&A for those. Rachel is asking, so if those who are vaccinated can still get COVID and still pass the virus to others, what is the benefit of mask wearing and how long will it be beneficial?
So I do think we need to be starting to look at the exit strategies for mask wearing. The Omicron is showing that it spreads pretty quickly, even in, like I said, in Israel and in places where they are masking pretty reliably. I mean, in Israel, people who don't mask are fined. So I do think we have to look at an exit strategy there. There's also some data coming out, and the CDC put the data out that the cloth masks are not as protective. Surgical masks, a little bit more so, and certainly if you knot and tuck, and then N95s, and certainly the fit makes a big difference as well when you're talking about masking. So, I do think right now we're seeing a lot of other circulating things. The masking has probably helped with those. Omicron is so transmissible. If it doesn't help with those, it might help protect against other things. And as cases are dropping off and we get down to that level, then I think that is a good time to start looking at what is our end game as far as the masking. And it's one of those things, I hate that it's become so divisive, because I do think in times when we have flu outbreaks and whatnot, that the masking, because flu tends to be larger size particles, more droplet, it might help prevent some spread there. So I don't want it to be an all or none. But I think, we do need to recognize there was a meta-analysis of a lot of masking studies that showed, and the CDC showed, and there's always going to be those trade-offs. N95s, if they are properly fitted, some people find them a little bit harder to breathe through for a longer time, a little bit harder to talk through. And the last thing you want to see is somebody who's wearing an N95, but then because people can't understand them, it's muffled, so they take the mask off when they're talking. That's worse. So I think it's one of those things that masking can be a tool in our toolbox. I think as viruses do, when they mutate and they become a lot more transmissible, especially if they are more towards the aerosol versus the droplet, the masking may not be quite as protective unless you really do have that really well-fitting N95 like a medical staff get fitted for. But that being said, even reduced protection is not no protection. And I think that's the other thing that gets lost as well. Just like when we talked about the vaccines when they first came out, were 90+% effective at reducing transmission, and they held up well with the Delta, and then they dropped down to 30% or 40% or whatever. That's still better than 0%. And we actually talk about this every year with the flu vaccine. It may not prevent you from getting the flu, but if it prevents you from going to the hospital and dying, then it's doing what we need it to do. So I wish people wouldn't take any of this as an all or none. And again, just look at the benefits and look at the trade-offs for each of these mitigation strategies, and just use them as we see fit and safest, and what can help us do our part to try and control it, realizing that we do have to continue to live our lives, and it's going to run its course.
James is asking, what levels would you have to see before you'd recommend eliminating masking?
I think just as England is a good example. They're getting rid of their mask mandates, and they're leaving it up to individual choice, and they hit their peak, and they've just seen that sharp decline. So I don't know if we see a 50% decline in cases or a 60%, 70%, certainly something more than a 50% decline in where our peak of our cases, I think, is a very reasonable thing to be looking at. And again, we do expect that those declines are going to be fairly sharp. So I don't think we're looking at months. I think we're literally talking about a week or two. We're hopeful, if they follow the pattern that we've seen, and if they follow the curve that we expect, that within the next couple of weeks, our cases will be down significantly, more than 50%, more than 75%. And then, I think it's very reasonable to look at that, especially given the data that we have on masks.
Okay, that appears to be all the questions we have for today. As always, we appreciate your time, and we look forward to the next time. Have a great day.
Thank you, Jen. Thank you, everybody.